Well, hi everyone. I'm Andy Asher. I'm editor of BloomerBoomer. Now, today we are talking with the co-founder and leader of Consortia Health, Gail Page. Her company is about pelvic wellness that provides diagnosis, therapy, and education to help physicians and patients with incontinence, pelvic pain, sexual dysfunction, and other pelvic disorders. In April, her company got $2 million financing to support rapid growth as a leader in pelvic wellness. In a moment, we will talk with Gail about her journey to co-founder and leader of this company and what it does to help patients and doctors and sufferers of urinary incontinence. Now, just want to let you know that this is part of the Good Life Movement Plus 50. It's a project of the BloomerBoomer.com publication where we bring stories and ideas from authors, thought leaders, and inspirational people. It is a movement for new and evolving things that make Plus 50 a good life. The shows are about what's working and what's not and how to make the best of it, and in the end, hopefully something that you can take away for yourself. Now, our guests are idea and thought leaders, experts, and people with life experiences to emulate, folks with a unique expertise, or those that give us, well, one of those aha moments or a revelation that can suddenly transform the complex and the bewildering into the understandable. And among those is our guest today, Gail Page, co-founder and the chair at Consortia Health. We'll be back with her right after this. Well, our guest is Gail Page, a co-founder and chair at Consortia Health. Well, Gail, thanks so much for joining us. And, you sort of have two interesting stories here. The one about founding your company, and then the other, of course, on the what your focus is. Why don't you start off telling us a little bit about how this got started?
So thank you very much for having me today. It's certainly a subject a lot of people don't like to talk about, but it is very near and dear to my heart. I've spent my entire career in healthcare. And after the birth of my baby and later in life having a hysterectomy, I too experienced the problem. Oftentimes when women laugh, cough, and sneeze, we leak. And as we get older, we leak a lot more, and it can translate into many problems that affect our lives. But somehow women felt like they had to live with it. And that was the spirit that drove me to try to get involved in this and do something about it. So it was really born from a problem that I experienced. And as I talked to women in my community and throughout the United States, I was just amazed at how many women were affected by urinary incontinence. Today, the reports say that somewhere north of 30 million women, somewhere between 30 and 50 million women experience the complications of urinary incontinence. So Consortia Health was founded around that to partner with the OBGYNs, which is oftentimes is a primary care physician for the woman. So we decided that we would put together a healthcare services company that could work in concert with the physician to diagnose, treat, and educate women around this particular issue.
Well, I see. So it sounds like you might say, in a way, demand necessitated the founding of your company, and one of those issues that isn't, as you say, isn't discussed a lot. How did you discover that there was a need out there, other than possibly talking with friends?
So in the industry, my career has taken me through the complexities of the OBGYN market, and there's just a huge demand. If you do the market research and you look at how many diapers are sold in the United States, what became apparent to me by doing the focus groups with physicians and just doing the market research that you would do, people were often treating the symptoms. Nobody was really trying to understand, well, what was causing the problem and how could we fix that problem or basically influence that problem in a positive manner before somebody gets so bad that they have to have surgery. And as we researched this in the market, what we found was that a lot of women were doing nothing, and then it would progressively get worse. And then women went through this time period where they were having surgery and they were having what's called a mesh, which would hold up the bladder. And if you read the newspapers, that resulted in a very bad outcome and lots of lawsuits. And then obviously a lot of women would progress so bad that they would have what's called organ prolapse. And that's where the pelvic floor becomes so weak that the bladder can fall out of the vagina. So, interestingly enough, the country of France had done a really good job of addressing this, and it dated back to the war. Fortunately for me, in a previous role where I was working in ovarian cancer, I had met a lot of folks internationally and was privy to know the head of the International Society of Gynecology and Oncology. And as we did the research, we were just perplexed at why no one had offered these services in the U.S. So we took it upon ourselves to develop those protocols. We worked with key thought leaders, understanding, how do we build this company so it can deliver the service, but it can also be a company that people would want to invest in and help us grow and make it available across the U.S. So we decided that a partnership with the physicians would be the first step so that women could be identified and women could be communicated to that, hey, there is something that we can do about it. And we call our solution the pro-pelvic solution because we're all about, pelvic wellness, about pelvic health. And that can include a lot of things. I think what most people don't realize that when women have incontinence, it's not something that they talk a lot about. But as you research it, what you find is that once a woman has incontinence and starts wearing pads, it psychologically makes her feel very uncomfortable. Oftentimes it makes her feel very old. There's a lot of depression that stems from it. There's a lot of problems with sexual health, which leads to marital problems. It's just unbelievable how far-reaching it is into their lives. A lot of women said to me, Gail, I can no longer jump on the trampoline. I feel like I can't go to the movie, and I'm constantly going to the bathroom, or I'm so worried that I'm going to leak, and if I laugh. So it's just unbelievable. So I'm very pleased to say that we've been very successful in raising the money to finance the company. We're now in 10 states, and we have about 60 employees. And what we do is the doctor tries to identify the women that are experiencing the problem. And then on the first visit that they have, we do a series of diagnostic tests. And what we do is we try to help the woman understand what type of incontinence she has. Does she have urinary incontinence, stress incontinence? And then the method of treatment becomes very personalized because then our nurses understand, how to administer the therapy depending on the type of incontinence that the patient may be experiencing. The woman goes through about 6 to 8 weeks of therapy once a week, 30 to 40 minutes. And we use a combination of electrical stimulation and electrical myography. And what we've experienced and been able to document, most women would report over a 90% improvement in their incontinence. And we have over 80% of the women that complete the entire course of therapy. So in the United States, most insurance companies cover the procedure. We decided as a company to take a very clinical and medical approach to the problem. And basically what we're doing is we're re-educating the pelvic floor. The muscles oftentimes during childbirth, they lose their elasticity, and often the pudendal nerve is damaged or it's in shock after the childbirth. So, and a lot of women don't get that back. And then what happens is those muscles get weaker and they get weaker. And so the involuntary loss of urine just becomes greater and greater. So what we do is we use the electrical stimulation protocols where we actually re-educate that muscle and start to strengthen it. And our job is to get that muscle where it's strong enough, and hopefully those nerves are firing on the synapses again, such that the woman can then start to feel it. And it's interesting that as we discuss with women upon their completion of the therapy, it's almost consistent that about the third or fourth visit, it's actually the brain starts to connect and it says, ooh, I can feel that again, because they've just lost that sensation.
So how does someone get in touch with you to check on how you can help them?
So there's two ways that they can. They can contact us. Our number is 1-888-375 www.consortiahealth.com. And they are more than welcome. If they're listening to this radio interview, they are more than welcome to ask for me personally. I will personally return their phone call and discuss, from a patient's perspective. We have a lot of different ways that we can help direct them to, if their physician is not one of our clients, maybe there's another physician. And oftentimes we've had women call us and we've been successful in getting their doctors to engage with us. They just didn't know that this was available. So we're definitely in a growth mode. We're definitely trying to expand so we can bring this to women across the United States.
Gail, fantastic. I think it sounds like you're just doing a fabulous service and have a good business. And people can get in touch with you, and you can check at BloomerBoomer.com for further details. Gail, thanks so much for your time.
Thank you so much for having us. We really appreciate it.
Absolutely. We'll be right back. Well, I hope you liked the show and learned a thing or two. The full show will be available on YouTube and at BloomerBoomer. The audio version will be available on Apple Podcasts, and we have other shows coming up. Some amazing guests. Please like us on Facebook and visit us at BloomerBoomer.com. Until next time, so long.